afternoon from sunny Kentucky, folks. Ain't been on this old box in a while. I'm kind of neglecting this channel. I need to get back on the ball and catch up. And been a couple factors to that. I've been going through some health issues. Those have been taking priority, at least in my mind. But that kind of leads to a minor rant. A lot of people don't realize, but unless you're in my position, it gets brought to your attention rather abruptly. First, a little history. Before all the COVID mess come out, started and got going, started noticing a loss in energy, loss in get up and go, and about the time I started taking it seriously, told myself, I was do a stress test and colonoscopy and that kind of stuff. I'm 50, so it's just that time of life. COVID hit. Of course, when it first come out, is the end all be all. Somebody breathes on you, you was gonna die. I decided it would not be a good time to go to the hospital to get, these routine tests done. My symptoms kept getting worse. It got to where taking a shower was a major endeavor, or walking to the mailbox, I was out of breath. It just killed me just to get up. I get somewhere and have to walk into receiving, 100 feet. It just killed me. And finally we got through the first thing of COVID before the second stage of COVID we're going through now come out. I said, well, I need to go ahead and get this stuff done. So I go to my doctor. He makes me an appointment with a heart doctor. He takes an EKG and everything on me and says it's all good. Something about me is I'm 5'9", currently 360 pounds. I have perfect blood pressure, perfect cholesterol, good liver enzymes. On a full blood panel, everything in my body is perfect, except for I have hypothyroid, which I'm currently taking medicine for. Have been for 15 years. And so I go to the heart doctor. And he does his normal, yeah, your dues, just go ahead and he did his more elaborate EKG on me. Did another full blood panel on me. Scheduled me for a stress test 6 weeks away. Now my first stress test, I went to the doctor and he had a stress test. They had me a stress test tomorrow. And then more or less explained to me, don't plan anything because we decide you need a stent or something, you'll be getting it. You'll be going right off to surgery, get that done. But anyways, they do me a stress test. At the same time, he says, you're a big guy. He said, you probably got some issues with sleep apnea. He says, I'm gonna order you a sleep study too. I'm gonna get with the sleep study doctor and we're gonna go ahead and see, because that can cause heart problems. I'm pretty sure, I have sleep apnea. It's always, anybody's got a CDL knows that's a dirty word. You don't want to breathe it around doctors, especially the doctor who does your medical for your license, because they can snatch it. So it's been one of them things I've always been a little touchy about getting handled. I said, we go do sleep, let's do all the tests we need to do. And So they said, we're going to refer you to this sleep study doctor, and meantime, you'll get your stress test, 6 weeks off. And echo, they did an echo with ultrasound, with ultrasound your heart, and then they made me wear a heart monitor for a week. And I go all the way to my stress test, never hear from this doctor, this sleep study doctor. A couple days, I took vacation during the stress test and stuff because didn't know what they was going to do, so went ahead and made arrangements to be off. I get a wild hair, and I said, well, I'm going to call the sleep study doctor. I call the sleep study doctor, and they say, well, no, you're not in our system. So I call my doctor. He says, oh, yeah, I referred you over there on XX date. He said, they'll get caught up, they'll get you. Okay. I go get my stress test and echo, and echo is perfect. My heart is functioning just the way it's supposed to. I had a mild abnormality in my stress test, which my heart doctor basically said, you got a blockage somewhere. I said, but probably not a real serious one, but it needs to be taken care of. So other than that, stress test was good. And my heart monitor came back, and they said it was perfect, it was fine. But he said it kind of reinforced that I need to get the sleep study because they could tell when I was sleeping on my heart monitor. So normally you'd get a stress test like that, and they say, well, you're going to need a heart cath. We're scheduling for day after tomorrow. No. 6 weeks off. So the current influx of this is when the D variant COVID was just getting good and fired up. We can't get no operating rooms. We can't get this. We can't get that. It's okay. And, well, I came up to 4 days from when I was supposed to have a heart cath. And I got a phone call saying, oh, we got to postpone it another 3 weeks. And just the day before that, the sleep study doctor called me. Now, he doesn't postpone my appointment once. Calls me and just outright cancels my appointment. Says he's got to go out of town. Doesn't know when he's going to, when he gets back, gets caught up, he'll call me back and give me another appointment. And that's where I sit right now. Deal where I know what's wrong, but you can't get it fixed. And I got damn good insurance. I have no doubt these are good doctors. The bottleneck is at the hospital, and they blame it on COVID. And here's where I don't even call it a rant, but my food for thought for y'all. You know, we hear on the news about all the people that's died of COVID, associated this, that, and the other to do with COVID. My wonder is, number I'd love to know, how many people have died because they couldn't get treatment for something else because of COVID. My heart doctor is fit to be tied. He says this all should have been handled inside a week. And here we are 4 months later trying to get a simple routine procedure done that at any moment a clot break loose and could cost me my life. or my mobility, or whatever. And the lady from the hospital called me and said, they can't because of COVID. I said, do you have COVID patients in the operating room? And she kind of laughed and said, no. I said, well, then why can't I use the operating room? Oh, it's just policy. There's some kind of bunk going on here, folks, and I don't know what it is. We had the first wave of COVID, and then they told us we need the vaccine. And they're trying their best to force that vaccine down our throat. And tell you the truth, I wasn't going to get it. I've never had a flu vaccine in my life. I've never had any vaccine except the vaccines we had to have in school and the vaccines I had to have in the military. But my heart doctor did say, he told me, he says, if you're going to go up in that OR in the hospital, or even go up in the hospital, he said, if you ain't got that vaccine, he said, you fucking moron. He said, you need to get that vaccine. And I trust him. He's a good doctor, and I trust him. And so I went in and I haven't even got the second shot of my vaccine yet, just got the first shot. And that's one thing good about the thing getting postponed, is it's going to enable me to get the second shot down before I have to go to surgery. And my alarm's going off in the sleeper. It goes off every day at this time, and I keep meaning to turn it off and never think about it. But like I said, something's going on here to do with this COVID mess, and I ain't saying that it's bunk, because I know many people that have gotten COVID. Fully aware of people that have died from COVID. And what's strange about it is the ones you would think that it would kill get through it no problem, and the healthy ones that you think that can tough it out, pretty healthy people, is the ones that kill. It's a really strange disease. I'll just leave it at that. It's strange. And but where COVID's got me thrown for a loop is what it's done to the rest of our system. Where it's the medical system, trucking, you remember when these vaccines come out, they said, you can get these vaccines and you can carry that little card around, and then places won't make you wear a mask because you've had the vaccine. I'll be down here the other day if I didn't go to a customer and they told me that I had to have a mask. I said, I've had a vaccine. They said, oh, those cards that people are faking those cards, so we don't know which ones are real. We don't know which ones are real, so everybody's going to have to wear a mask until further notice. So now they're going around. They tell us we got to get this vaccine so we don't have to wear a mask. Now they're saying that, oops, we know you got this vaccine not to wear a mask, but so many people are faking it that you're going to have to wear a mask anyway. Sorry. I don't get it. And I'm not one of those mask Nazis. I don't wear a mask unless they force me to. I I don't think it's really doing you all that much good. Just having friends that are health professionals and what that mask is actually doing. Isn't really protecting you or anybody else. So it's you're being a good compliant little citizen. I got a visual way of seeing it. But yeah, that's basically my rant. I keep you all updated. I'm starting to actually feel better. I'm getting around better, and I'll be happy when I can finally get rid of this water weight. That's one part I didn't mention is one of the things that drove me to the doctors. I said I was 360 pounds. Well, January the 1st, I was about 290. And I really don't eat that much. I don't. I used to eat completely out of hand, but I'm not that bad of an eater now. And for me to put on 70 pounds of basically what I understand to be fluid, the legs are all swollen up. That's the whole reason we're chasing this heart dragon as it is. But what I understand is sleep apnea can also cause that. So I gotta chase that dragon too, and get through that little problem. I think to fix both problems, but we'll see as it pans out. I'll keep you all informed. My point is of this, really, if you're out there, and not just you fellas out there driving these trucks, because you're real susceptible to go through what I'm going through right now, but just anybody. If you're not feeling right and you know you're not feeling right, I understand, give it a week or two, you know, to see if it ain't just, you maybe got a little bug or something. But persistently, if you're going downhill, go get it checked out. Because this is probably something that should have been handled 2 or 3 years ago. That I just kicked the can down the road. Take care of your health. You've heard me preach that in other videos. So I'll tell you what, your life ain't spooky. If you're out on this road somewhere by yourself in the middle of the night in this truck, and your heart goes to pitter-pattering, fluttering or whatever, you know, something ain't right with your body, and you know it. You know, either you got chest pain or shortness of breath or whatever, you know. And a lot of times that's anxiety. That's my problems. I'd have a feeling like that, and then anxiety would take over and almost mimic the symptoms. But be out here in the middle of the night and go to think you might start to be having a heart attack, and you're all by yourself out in the middle of frickin' nowhere. And you gotta have that little heart-wrenching discussion to yourself. You're gonna pull over on the side of the road, call an ambulance to yourself. Don't let it get there. You know what your body's supposed to feel like. If it does not feel right, find out why. if you're over 40, 45 years old, whatever your doctor thinks, go get you a stress test. You ain't got to run on the damn treadmill no more. They sit you in a chair and inject you full of all kind of good chemicals. And your heart goes to fluttering and you feel like you're going to pee yourself. They take some pictures of you and it's done. Insurances are more than happy to pay for it because that stress test is a hell lot cheaper than a heart attack. Or if you let it go so far they got to do open heart surgery. That's when it gets expensive. They'd much rather pay for that stress test in a heart catheter. That's just a smart business decision on the insurance companies. But like I say, if your body ain't doing right, you know it ain't doing right. Go find out why. And if you go into a doctor and he just smiles at you, pats you on the head, tells you need to drink more orange juice, can his ass go find another doctor. There's entirely too many of them out there today. Like I said, it's your body. You know what it's supposed to feel like. If it don't feel right, find out why. Eventually, you'll look up on a good doctor like my heart doctor, or even I've actually got a family doctor, and then my company's got a clinic that also has, it's a nurse practitioner. But I can tell you, she's a meticulous little chick. She's like a bird dog. She wants to, if you got a problem, she wants to find out what it is. She gets determined. Because ain't nothing to piss me off more than a doctor you go in there and see that just blows you off. He just, like I say, smiles and pats you on the head, gives you a lollipop and sends you on down your way. Basically tells you you're stupid. I get very angry when I run into one of those doctors. But that's long enough for this video. And like I said, I'm gonna be on here more now. I'm getting this under control and get back to tending to this YouTube channel. Hopefully soon we can go back to the normal stuff and just bitching about dispatchers, DOT officers, bad drivers, all the normal stuff. Because that's the number 2 job of a truck driver. Number 1 job is for him to drive a truck. Number 2 job for him to bitch and complain. So we'll get you some more of that too. But y'all have a fine day, and I'll catch you on the flip side.